Now, a quarter of care home staff are opposed to taking mandatory COVID vaccinations. That's according to a survey of health workers' responses to the government's announcement that all staff in registered care homes in England must be vaccinated, including anyone entering a care home.
Well, Adam Purnell is the manager at Keppelgate House Care Home and joins us now. Does that figure surprise you, a quarter?
A quarter opposing doesn't surprise me. I think the estimates of it being between 3 and 12%, I think it is, of actual refusal of the vaccine is a little bit more surprising, especially the higher end of potentially 70,000 people who are currently in the registered workforce not wanting the vaccine. I think is quite a terrifying number for workforce reasons as well as safety reasons.
Didn't we, a while ago, a few weeks ago, when this was sort of first discussed, and I know that you were pretty opposed to these mandatory jabs because you haven't got enough staff anyway. So you could see where this was going. In fact, in the care work sector, there aren't enough staff, are there? How are you feeling now? Has your view changed on this at all?
No, as a matter of fact, I'm part of a group of managers with 5,700 plus. It's a support group, and we've actually written an open letter to the Health and Social Care Committee asking for some support now because the recruitment crisis is getting unmanageable. There's currently around 120,000 vacancies in social care. Adding on top of this, a 70,000 more on the 11th of November is just going to make things even harder. Recruitment, it just isn't possible, whether it's pay, whether it's funding, whether it's working conditions, recognition. Something needs to be done to support the sector now, because without these people, we aren't going to be at safe operating levels. So regulators are fine to say if we have people working in our homes that are unvaccinated, we're going to get reprimanded. But we're also going to get reprimanded for working at unsafe levels. And yet there doesn't seem to be a safeguard or support from anybody outside of the sector to go, this is how we're going to help make sure that you're all staffed. There's just no answers coming from anyone.
Adam, we're looking at staff, but what about residents and their families? One would assume that if they were asked, they would want staff to be jabbed.
I mean, completely. Everyone wants everyone to be as safe as possible. Safety has to be looked at all angles. It has to be holistic. The virus isn't going to prevent them from being safe from pressure sores or decreased tissue vitality or falls or malnutrition if the staff aren't there to support them. Fortunately, relatives aren't being asked to be vaccinated before they can come and visit their loved ones, which is absolutely fine. I think that's the right decision. But that, for me, is only going to further animosity between care providers and relatives, because providers are going to go, well, if you don't need to be vaccinated, why do my staff? I spoke to a provider yesterday evening who gave a completely different outlook on it, and she runs a learning disability home, and in the peak of summer, when all the weather's great, most of her residents spend all of their time outdoors, in shops, working. They don't have to be in contact with people that are vaccinated outside. And yet, when they come back to the care home, which is where they'll spend just the time to go to bed, all those staff need to be vaccinated. So it begs the question, why isn't the whole of society vaccinated? Because it then makes you feel that people in care homes are going to be ostracised and not going to be able to go out and enjoy the full benefits of the community because we're being told that they need to be around people that are vaccinated.
But I mean, obviously, your fear is the fact that a lot are refusing. A lot of care workers, they don't want it to be mandatory. You haven't got the staff. I'm interested, actually. Why is it so difficult to recruit? Why are these numbers so high? Vacancies so high?
So, I mean, recruitment's been difficult now for, I'm going to say, the last 3-4 years. The pandemic has only exacerbated it. The fear of probably working on the front line or being targeted by the media as being unsafe, unskilled, unprofessional. I think that has added to it. I think pay is definitely a huge thing. There's a pub around the corner from us that are advertising at £10.50 plus an hour for people to work on the bar, and we just can't compete with that. We don't have the funds coming in to be able to pay people that. So I think there are a lot of factors that have not been addressed because we keep putting off this social care reform, which we were promised nearly over 2 years ago now, when Boris stood on the steps of Parliament declaring that he was going to help change and fix social care. That keeps getting put off now. So the idea of fixing recruitment has just been pushed back and pushed back and pushed back, and we've not even tried to fix it. Even recruitment agencies, I mean, temporary staffing agencies. Care homes sometimes have to rely on temporary staffing agencies. Even they don't have the staff now to supply care homes temporary cover to make sure they're meeting the actual levels they need to meet. I've known managers, and I did a poll in the group last night just to get an idea of it, and I think I had about 200 responses, and of that, 80 people said they were contemplating leaving their management role. 28 have said that they've already left the management role. And I think about 10 had said they were leaving the sector completely. You know, we're losing amazing people from the sector now because they just can't take it. Burnout is getting too much for them.
It's remarkable, isn't it, Adam, given that this pandemic has very much put the focus on what you do, the importance of care homes and the work they do. And yet we're in this position. Why?
I wish I could give you the answer. You know, everyone back in May last year, and we're all stood on the doorsteps clapping for NHS and social care workers, and everyone was congratulating us what we do. And don't get me wrong, we still get a lot of congratulations. You know, our relatives still come in and go, "Oh, you're doing such an amazing job. It's absolutely wonderful." But there is this spin that we are unskilled. There isn't a career progression here. There isn't a hope for people who come into social care. It is a dead-end job for people who can't achieve anything. And I just think this vaccine has just... I believe people should have the vaccine, do not get me wrong, but forcing it is only going to increase mistrust within the sector. And for people not to have the vaccine and then be vilified for it when they've done such an incredible job this last 19 months is heartbreaking. I'm not going to lie. It's absolutely soul destroying when I can see these people going to work day in, day out, sharing the stories that they share and the love they've got for the people they support, to then be turned into these bad guys. And I wish I had the answer, but I don't.
Yeah. I mean, given that this is a vocation, if there was a clock and you could go back in time, would you still go into this job?
Oh, 100%. 100%. I mean, it's something that I live and breathe. I absolutely love. And I think this is something that the impact assessment from the government completely ignores, because they talk about the cost of replacing people. They talk about the ability to replace people. They talk about how if there's a concentrated amount of care homes in one area that are losing staff, that they're all going to be digging from the same pool, so it'll be difficult to replace people. But they don't talk about the fact that you've actually got to want to be in care. You've got to have that drive. You've got to have that willingness. And there are so many people out there who, I don't know, might work in banks or supermarkets or grocers or work as teachers who are sitting there going, actually, I really am not enjoying my job anymore. I wish I could just help people. And that's what we need to target. We need to target these people who have the big hearts, who want to make a difference to people's lives and really want to do this. Otherwise, we're just going to fill the sector with, well, we're not going to fill the sector anyway, but we'll end up filling it with people who want to come and do it just to get some money, and we'd still be moaning about the quality of care.
Adam, thank you so much. You're doing a great job. We hear your frustrations. We really do. We hope things do change. It needs to change, doesn't it? Thank you very much indeed.
It's good to have a proper chat, isn't it, Adam?
It is, and it's nice to be heard. You know, we always spoke about how social care never got heard, and it's nice to finally have our voices being listened to. So, you know, thank you for the coverage on it.
Pleasure, and we'll talk to you again soon, I'm sure. Adam, thanks very much.